lecture on eyelids. Before we move on, to the today's topic, let's recapitulate what we learned in the last lecture. So, we discussed lesion and the difference between style and lesion. These are the inflammations of the glands of the lids. And just to remind you, style is a painful lesion and lesion is a painless chronic granulomatous inflammation. And if we move backwards, then we discussed blepharitis, its different types, anterior blepharitis, posterior blepharitis, and its treatment. The mainstay of treatment of any kind of blepharitis is basically lid hygiene. Lid hygiene with baby shampoo in a small warm bowl of water. And the medicines which we give, mycelides and drops and ointment, they secondarily act, but the mainstay, you must remember, जिस तरह सर के बालों में खुश्की होती है, इसी तरह आंखों की पलकों में जब खुश्की होती है तो उसको ब्लेफराइटिस बोलते हैं. मेडिकल लैंग्वेज में उसको बोलते हैं इन्फ्लेमेशन ऑफ द eyelid margins, इन्फ्लेमेशन ऑफ द eyelid margins. ये हमने पिछली दफा डिस्कस किया था. और सबसे पहले हमने आईलिड की एनाटॉमी पढ़ी थी, जिसके 5 मेन लेयर्स हैं आईलिड के, जो मैं एक दफा रिपीट कर देता हूँ. एंटीरियर मोस्ट लेयर इज द स्किन, नंबर 1. द सेकंड लेयर इज द सबक्यूटेनियस टिश्यू, which contains blood vessels and nerves. The third layer is the muscular layer, which contains orbicularis oculi, which closes the eye, and levator papularis superioris, which elevates the upper eyelid. And all the 5 layers are present in both the upper and the lower eye, except the levator muscle, which is only present in the upper eye. Fourth layer is the tarsal plate, and the fifth and the innermost layer is the tangential. So these are the 5 layers of eyelid. कुछ बुक्स ने 8 लिखे हुए हैं, कुछ ने 7 लिखे हुए हैं, सब ठीक है, लेकिन मैं आपको बेसिक बता रहा हूँ. ये कम से कम 5 आपको जरूर बताऊंगा. तो आज हम स्टार्ट करते हैं बिस्मिल्लाह करके, जहाँ से हमने छोड़ा था. So we will start today, not a very long lecture. Anomalies in the position of the lashes and eyelid margins. So first of all, trichiasis. Just see this picture, and I hope मैं पीछे जाता हूँ तो ये इसका रिमोट काम नहीं करता. I hope कि आपको नजर आ रहा होगा. These are, silence please. These are inward turning of the eyelashes. Can you see? अगर आप लोगों को समझ ना आ रही हो, you can stop me there and then and ask questions. I always stress upon you at every platform, whether it is in clinics, in lectures, on social media, whatever I use, I always stress upon on two things. Let me repeat these things. One, ask questions. Because question must arise in your minds. If a question doesn't arise in someone's mind, it means either the teacher is Superman, which is very unlikely, or the students are super students, which is also unlikely. So some things are always left ununderstood, even in the best scenarios. So if a question is not arising regarding the subject in your minds, then you must question your own self. Why the question is not right? Secondly, being as you are going to be doctors inshallah, and medicine is a very tough and a dry subject. To keep you people, to make yourself alive, apart from your studies, I have been urging upon this thing on the basis of my own experience since many years, almost 15, 16 years since I am teaching, that everyone must have a hobby apart from the medicine. Whether it is writing, it is sketching, it is music or whatever. These are very practical tips. And it will re-energize you because the medicine consumes most of the energy people have. So, this is I used to tell to every class. Now coming back, this is the inward turning of the eyelashes. In the previous lecture, we discussed that normally the eyelashes of the upper eyelid goes outward and upward, and lower eyelid goes downward, upward, and downward. If they are misdirected, for example, the lashes in this case are misdirected in the cornea like this, and they are rubbing the cornea. This situation, this condition is called trichiasis. That is misdirection of the eyelashes. And it is not because of any deformity of the lid margin. Keep it in mind. This is primary trichiasis or real trichiasis. Now what happens? Defined as misdirected eyelashes, so they are directed backwards and rub against the cornea, which is a transparent structure, cornea. Entropion, which we will be discussing, due to any cause, entropion is the, for example, this is my lower lid, and by some pathology it is rolled in, then it will also cause trichiasis, but that will not be real trichiasis. It will be pseudo trichiasis or secondary to entropion. And so entropion due to any cause, especially trachoma, जिसको उर्दू में कुक्के बोलते थे, आपने सुना होगा, it is caused by media trachomatis, and it causes the fibrosis of the upper eye, which you can see, and it has caused the turning of the lid margin. Other conditions leading to scarring of the conjunctiva, the innermost layer of the eyelid, such as chemical burns and Stevens-Johnson syndrome, can cause pseudotrichiasis. Okay, so this is what I told you. Forget about this congenital trichiasis right now. Now, what are the complaints of the patient? Obviously, patient will be complaining of irritation, lacrimation, lacrimation means increased production of the tear because of the stimulation of trigeminal nerve, and it is a watery eye. Watery eye because of decreased drainage is called epiphora. So you must be able to differentiate between whether it is increased production or decreased drainage. So it is related to the cornea. So it is increased. It means that it is causing the irritation of the cornea either and producing more tears because of the irritation of the cornea, which is a very sensitive part. Foreign body sensation, reflex nephrospasm आपकी इस तरह बंद हो जाएगी. Photophobia, light जो सी है वो आँख में लगेगी and obviously redness from the conjunctiva. Later on, superficial complete erosions on the cornea, corneal opacities, vascularization of cornea may occur. In this picture it is not clear, but when the eyelashes rub on the cornea, you can imagine its epithelium will be eroded and it will be ulcerated. And these erosions are very painful at times, very painful. So, what is the treatment? Treatment is number one, epilation. That is, remove the picture आप देखिए पिछले इसके अंदर तो there was a bunch of eyelashes जो अंदर की तरफ आई हुई थी. कई दफा ऐसा होता है कि सिर्फ एक या दो लैशेस मिसडायरेक्टेड होती हैं, स्पेशली यंग एज में. ओल्ड एज में ज़्यादा भी हो सकती हैं. So depending on the severity, epilation, that is removal of that affected eyelash on the slit lamp with the help of the forceps. Simple. And often we have to do it quite often and because of the recurrence. Second process to stop the recurrence, we do electrolysis. It is done by a machine. It is done by a machine which has a pen-like structure and it causes the destruction of the follicle by heat from where the misdirected eyelash is arising. So now it will by heat or thermotherapy, it will damage that follicle and recurrence will not occur. For permanent treatment, we do electrolysis. And cryosurgery is opposite to that. That is freezing. There are many eyelashes turning inwards, and it is difficult to epilate each one and to do this is electrolysis, or if it is ineffective, then we apply cryotherapy, a probe which is freezed at almost -60 to -70 degree temperature, which mechanically destroys the follicles. So they are permanently, eyelashes are destroyed. Though it is a destructive procedure, but here our main concern is to protect the cornea and the teeth. Because if we leave it, it will cause corneal ulcer, retinopathy, opacity, and patient can have permanent corneal opacity. And if the patient's trichiasis is secondary to entropion, then we will correct the cause. So this is trichiasis. It is very important from the clinical exam point of view, clinical point of view. Now let's move forward. Entropion. आज हमने पास दो चीजें होती हैं, ठीक है? एक एंट्रोपियन जिसमें इनवर्ड टर्निंग ऑफ द मार्जिन होता है, और एक एक्ट्रोपियन है जिसमें आउटवर्ड टर्निंग ऑफ द मार्जिन होता है. We have got 6 lectures on eyelids. So मेरी कोशिश ये है कि हम स्टेप बाय स्टेप इस तरह चले कि बाय द एंड ऑफ द 6th लेक्चर इंशाल्लाह आप लोगों को का एक कंसेप्चुअल अप्रोच बन जाए ऑप्थेल्मोलॉजी, rather than इसके कि आप उसको क्रिस्टलाइजेशन वाला। अच्छा जी, एंट्रोपियन क्या है? आप इस पिक्चर को देखें, inward rolling of the lid margin is called entropion and is caused by disparity in length and tone between the anterior skin muscle and posterior tarsoconjunctival part of the eyelid. इसको एवर्ट करेंगे तो नजर आएगा, वो अभी नहीं पता रहेगा। सिंपली आप इतना याद रखें कि ये नॉर्मल आईलिड, ये दिस इज लोअर आईलिड मार्जिन। अगर ये यू टर्न कर रहा था या बल्कि इस तरह कर लें, ये आईलिड मार्जिन है, ये इनवर्ट टर्न कर देता है इस तरह, तो ये जो आई लैशेज हैं ये जाके कॉर्निया पे लगेंगी। अगर ये ऊपर है और एंट्रोपियन है तो ये दोबारा आई लैशेज जाके उस पर लगेगी और मार्जिन भी लगेगा। सो इट इज अ ड्यू डैमेज, वन इज बाय द लिड मार्जिन and the other by the lashes, pseudotrichiasis, and again it will cause damage to the most important structure, one of the most important structures in the eye, that is transparent cornea, which is necessary for the perfect vision. The causes of entropion are involutional, that is by age, cicatricial, that is by after scarring, spastic or congenital. Involutional or sliding entropion. It is the most common type. There is general instability of the lid structures. As we age, the skin becomes lax, wrinkles appear on the faces. So because of these consequences, the lid's integrity is no more present, and in some people it occurs earlier, in some people it occurs later, in some people it doesn't occur at all, but it is the most common, still the most common type. There is a general instability of all the eyelid structures which I told you. A weakness of the posterior retractor along with the laxity of the canthal ligaments is seen. Loss of support due to orbital fat atrophy. If you touch your index finger at the inner canthus and the outer canthus, like I am doing, you can feel the ligaments. These are called inner and outer canthal ligaments. They become weak with the passage of time because of aging. They have held the eyelid in position. When they become lax, then either entropion or ectropion can occur, or you can simply say that the eyelid will not be at its right position. Got it? Okay. It is the simplest way which I could tell you to understand by these laxity of the canthal ligaments, inner canthal ligament and immediate lateral canthal ligaments. Loss of support due to orbital fat. In eyelid, in the layers of the eyelids, there is a fat which is there to make the shape of the eyelid and support it. With the passage of time, the atrophy of all the structure occurs, including the fat, and it also contributes towards instability of the eyelid and ultimately either entropion or ectropion. This is something which you will understand well when you will see a picture which I might show you in the next lecture, but let's read it. Pre-tarsal orbicularis is attached firmly to the tarsus, but the attachment of preseptal orbicularis are lax, and a tendency of preseptal to override pre-tarsal orbicularis occurs. Lower border of the tarsal plate rotates forward and margin of the lid is rolled towards globe. समझ नहीं आई? नहीं आई, ठीक है, ये बड़ी मुझे समझ आता है। अब नई बात देखेंगे। ये आपकी लोअर आईलिड है, ठीक है? ये जो बात कर रहे हैं ये पैथोजेनेसिस बता रहे हैं। फिर ये ऑर्बिक्युलरिस थर्ड स्ट्रक्चर है जो यहाँ पर एलिड मार्जिन के पास ये है प्रीसेप्टल ऑर्बिक्युलरिस, और जो नीचे है इसको बोलते हैं प्रीसेप्टल पार्ट ऑफ द ऑर्बिक्युलरिस। ये ओवरराइड कर जाता है इसके ऊपर, यानी कि बाय सम पैथोजेनेसिस by the mechanism of disease, this orbicularis, this part of the orbicularis muscle overrides over the pre-tarsal and it pushes this structure inwards. Got it? Now it causes the entropion. And to your surprise, and it was also a surprise for me when I first read that God knows the exact mechanics of entropion. The same process can cause ectropion also. The reverse of it, the upper part will override the lower part and it will become outward and cause the ectropion. समझ आए कुछ? ओके जी। ट्रीटमेंट lid emerging sutures. We apply sutures in a matter sutures in a special way so that the eyelid is inverted. It is the simplest procedure and very effective. We will show you its video. Until then you will not be able to understand it. And we do the procedure which is called V's procedure. You just remember the names and I will show you the videos of these surgeries. Right? Two procedures आवाज में आए please. एक लीड एवर्टिंग सूचर है जिससे वो आईलिड को दोबारा रिवर्ट कर देते हैं, किस तरह लगाते हैं वो हम देखेंगे, और दूसरा एक वील प्रोसीजर है उसमें कट देके आप आईलिड पे करते हैं, कैसे करते हैं we will see. For now let's move on to the second cause of entropion, which is cicatricial entropion. Cicatricial after scarring, for example after the alkali burn, acid burn or something like that, when the fibrosis occurs in the upper or lower eyelid and it causes the scarring and ultimately fibrosis. Cicatricial contraction of the palpebral conjunctiva, ये scarring results in relative shortening of the inner tarsal conjunctival lamina of the lid and inversion of the lid margin. जैसे आपको पता है ट्रकोमा, स्टीवन जॉनसन सिंड्रोम, that is allergic to any medicine, most commonly sulfonamides, chemical burns and ocular cicatricial palpebral are the usual causes. Plastic surgery is in the form of lengthening of the posterior lid lamina, tarsal rotation, tarsal fracture and skin grafting are the treatment options. It is difficult to treat and we will have to remove the scar tissue and we will have to place the graft which we take really from the lower part and behind the ear or the oral mucosa, or we sometimes use amniotic membranes. We nowadays we prepare amniotic membranes from placenta and we use it for in several procedures in eye where to improve the healing. So this is a tough job to treat this cicatricial entropion. Spastic entropion, spasm of orbicularis in response to irritation is the cause. Spastic entropion is almost always restricted to lower lid. Lower lid is being supplied by salmon nerve, which supplies to the orbicularis. Facial nerve. If it becomes irritated, or any branch of it becomes irritated, it can cause the permanent spasm of the upper or the lower eyelid, and it can cause spastic inward turning of the lower lid or upper lid. Remove the cause of irritation. Surgery is performed to create a ridge of fibrous tissue in front of orbicularis to prevent overriding of the orbicularis. Like senile, as I told you, inverting sutures. आपको ये वर्ड याद हो जाना चाहिए, inverting sutures, ठीक है? और V's procedure, ये दो आपको नाम याद हो जाने चाहिए. उसमें भी यही करते हैं. You will see how we do it. Now, congenital entropion is a very rare condition. Due to dysgenesis of lower lid retractors or a developmental anomaly of the tarsal plate, which is a fibrous tissue causing the lid margin to turn onto the globe, treatment should address the cause. As you can see, the tarsal plate is not developed. Tarsal plate is the thick fourth layer which causes the eyelid to stay in position to give it the integrity. When it is absent, then either entropion or ectropion may occur because the eyelid has no structure to stabilize it. Getting my point? Yes. Getting my point? ये पूरी रोड से अगली बहुत बातें कर ली समझ आ रही ओके common differential diagnosis is epiblastoma where an anomalous skin fold pushes the eyelashes onto the eyeball. Epiblastoma में एक एक्स्ट्रा स्किन फोल्ड होती है यहाँ पर और वो उसको पुश कर रही होती है अंदर की तरफ. And it creates the confusion whether it is congenital entropion or epiblastoma. So we will have to look for it. Because extra layer तो नहीं है. Now we are coming to our last topic today. Attendance हो रही है आपकी? दिन भी नहीं हुई today. Now we are coming to the last part. Ectropion. It is the opposite of entropion. Like if this is the lower eyelid margin, the eyelid margin will roll out. As a consequence, the eyelashes which were supposed to at the position of outwards and downwards, they become more so, more outward and more downwards. And the one important thing which you must remember is ectropion. As I told you that in entropion, our main concern is to save this structure for me. Very good. And in entropion, what happens? What really happens because of lacrimation, increased production. In this case, the eyelid margin becomes away from the globe, and each one of us has two punctum in each eye, upper eyelid and lower eyelid, which is 5 mm medial to the inner canthus. You can invert slightly your eyelid, lower eyelid or the upper eyelid, and you can see it with a torch or with a naked eye. And 90% of the tears are drained from the lower eyelid because of gravity. If upper eyelid is involved, then it is unlikely that the ectropion will cause watery eye. But in this case, what will be the cause of watery eye? We will just see it. First, it strikes. You can see it is just opposite of that. Acquired are same causes हैं. Involutional और senile, psychotricial, spastic की जगह paralytic आ गया और mechanical आ गया, इसमें congenital आ गया. It develops as a result of laxity of suspensory system, जैसे उसमें हुआ, of the lower lid and the medial and lateral canthal ligaments. This laxity is accompanied by a horizontal lid lengthening of the skin of the lower eye. जिसका स्किन लैग हो जाती है, इसमें lengthening होती है, साथ में canthal ligaments की weakness होती है. इसमें एक चीज आप देखें कि ये punctum है, which is not in contact with the globe. ये भी is not in contact with the globe. Punctum नजर नहीं आ रहा है इसमें. लेकिन ये है अगर गौर से देखें, इट शुड बी इन कॉन्टैक्ट विद द ग्लो. सो अच्छा, इसमें अब क्या सिम्टम्स हो सकते हैं? मैं आपको आप मेरे व्हाट आर द पॉसिबल सिम्टम्स? पेशेंट विल कम टू यू, एक तो कॉस्मेटिकली होगा कि आपको इस तरह होगी, बट व्हाट प्रॉब्लम द पेशेंट माइट बी फेसिंग? एनीवन? हाँ, थोड़ा सोचें. मैंने आपको जो बताया है उसी के अंदर इसका जवाब है. लैक्रिमेशन नहीं, थोड़ा सा आप इसे इम्प्रूव करें. ड्राइनेस तो नहीं होगी. क्या होगा? पंक्टम इन कॉन्टैक्ट विद द ग्लोब नहीं है, तो टीयर जो प्रोड्यूस हो रहे हैं वो ड्रेन नहीं होंगे, तो इट विल आल्सो बी अ वाटरी आई लाइक entropion, but this watery eye is not because of lacrimation. This watery eye is because of decreased drainage. So there will be no dryness, instead there will be more water in the eye, and it will be resistant to the watering, and many people develop secondary eczema on the cheeks because of dipping of these continuous tears. So now I ask you a question. God forbid, if you have to choose to select, this is the question which our teachers used to ask to us. I am asking you the same question. If you have to pick one of these two diseases, which one will you pick and why? अगर आपको आज में समझ आया तो इसका आंसर बड़ा सा अगर आपको, if you have to choose to have a disease, God forbid Allah ना करे, from entropion or ectropion, which one you will prefer to have? Ectropion, right? And why? Yes, because besides all the complications, cornea will not be damaged, it will remain transparent, and the vision is usually not affected. So the treatment is retropunctal cartry, that is, this is the pivoted, outward inverted mid part. हम इसकी कंजक्टिवल साइड पे, ये स्किन है, और इधर मोस्ट लेयर आईलिड का कौन सा कंजक्टिवल, यहाँ पर हम गर्म स्लाइन लाते हैं जिसे हम वाटरी बोलते हैं. उससे क्या होता है, जब लगा देते हैं इट फाइब्रोसिस एंड इट कम्स बैक इट इज माइल्ड. ठीक है ना, अंडरस्टैंडेबल है, कॉमन सेंस की बात है. ठीक है, फाइब्रोसिस हो जाएगा, यानी कि हम साइकियाट्रिशियन फाइब्रोसिस और साइकियाट्रिसिस जो सब क्रिएट कर रहे हैं. दूसरा है मीडियल कंजक्टिवोप्लास्टी. इसमें we cut a part of the conjunctiva, a diamond shaped part of the conjunctiva 4 to 8 millimeter from the medial side, और बाद में उसको स्टिच कर देते हैं. इसकी भी पीछे थ्योरी वही है कि आप जब कंजक्टिवा शॉर्टिंग करेंगे, मीडियल साइड में इसलिए करते हैं कि कम से कम पंक्चर की पोजीशन आ, और मीडियल एक्ट्रोपियन से नहीं करते. अगर पूरी आंख है तो उसका ट्रीटमेंट बाद में दूसरा आएगा. Medial conjunctivoplasty, that is cutting a part of the conjunctiva and then we stitch the remaining conjunctiva, again contracts the eyelid back towards its position as near as possible. Then the surgical treatment, if it is in mild to moderate cases, there are a couple of procedures like in the entropion it is Reese procedure. Here they are lazy deep procedure or its modification, and in severe cases, especially the lateral half falls away with the laxity of the lateral ligament. Conrad Jubinowski इसमें एस साइलेंट है, कोनॉट जिमिनोव्स्की प्रोसीजर इज परफॉर्म, ये भी आपको वीडियोस के बगैर समझ नहीं है, ठीक है। तो ये गठिया आपको मैं दिखाऊंगा। तो अभी तक कोई क्वेश्चन, एनी क्वेश्चन आपके लो फ्रॉम दिस लेक्चर और द प्रीवियस वन? कोई नहीं है? क्वेश्चन मस्ट अराइज, नहीं तो आपने मसला है मेरे को है? हम सिंपल कर रहे हैं ऐसे, हाँ बिल्कुल। और क्वेश्चन है कोई बेस है तो इन कावा को मतलब एयर को हर वक्त एक्सपोज है, तो will it not be damaged? It will not be very good question. Yes, it does damage. Damage occurs in the lymph cava. It can cause from severe dysplasia to severe fibrosis and many other problems of the lymph cava. So it must be taken. Otherwise, the lymph cava is the first part which will be affected, and when the lymph cava is affected, the glands which are present in the lymph cava which secrete calcification of the tear film, they will be damaged also, and the tear film which is normally present in front of our eye will be disturbed, and the vision will also become secondarily affected. So इसका treatment, इसकी correction. Any other question? Okay. Can we